This is a professional and ethical compliance code for behavior analysts. Section 2, Behavior Analyst Responsibility to Clients.
Under no circumstances should a behavior analyst accept clients who fall outside the parameters of their skill set and experience. To ensure such is always the case, a behavior analyst must work under the supervision of someone whose credentials allow them to supervise. In 2022, this code will change from Code 201 to Code 303, accepting clients. As a behavior analyst, your responsibility is to everyone affected by the service you provide. If there are multiple parties involved, such as an agency, parents, children, caregiver, and the individual receiving the treatment, you create a hierarchy based on the relationship to the person receiving the treatment. It is also your responsibility to advocate for the best interest of the person receiving the treatment, no matter what the situation. It is also important to note that in 2022, this code will be moved to Code 301, Responsibility to the Client, and Code 302, Identity of the Stakeholders.
The next subsection is 2.03, which is consultation. There are two parts to this, and the first part is behavior analysts arrange for appropriate consultations and referrals based principally on the best interests of their clients with appropriate consent and subject to other relevant considerations, including applicable law and contractual obligations. This basically just means that behavior analysts are responsible for organizing referrals and consultations based on the betterment of their clients, and it's essential for them to gain proper permission from the client, and it's vital to take into consideration the legal duties and the obligations while making any type of referrals or consultations on behalf of the client. The next part is, when indicated and professionally appropriate, behavior analysts cooperate with other professionals in a manner that is consistent with the philosophical assumptions and principles of behavior analysis to effectively and appropriately serve their clients. This basically just means that in order to serve their clients effectively and whenever they deem necessary and professionally suggested, behavior analysts may collaborate with other professionals in a way that they think may benefit the client, and they have to consider the philosophical assumptions and the principles of behavior analysis. Modification in subsection 2.03 due to the Ethics Code of 2022, they added subsection 210, which is collaborating with colleagues, and subsection 3.06, which is consulting with other providers.
Third-party involvement in services. When making referral for other treatments from third-party professionals, it is important to cover your bases. Be sure to disclose any relationships that may be deemed first-person relations or personal. At the onset of any client analysis relationship, it is important to be upfront and honest about any potential conflicting relationships you may or may not have. For example, if your cousin is an occupational therapist in the same city and you believe that your client could potentially benefit from their services, ensure that you're providing several options for them and not operating biasly. It is also very important to ensure that no incentives and or compensation such as payments or gifts are being accepted for this referral. When providing direct services to vulnerable individuals or minors, ensure parental and client surrogate consent is given and the recipient is fully informed of the services being provided. Be sure to communicate in a way where the client understands their rights and the services being provided to them. It is the responsibility of the behavior analyst to ensure any care being provided to their client is client-centered based and in the best interest of their client. For instance, if you're working with a third-party professional such as a speech pathologist or an occupational therapist and they suggest care or intervention that may contraindicate your recommendations as a BA, it is important that any route or action being taken on your part is all being done with the intent of the client's needs being met to the best of our ability. If conflict cannot be resolved, there should be a transition before a complete halt of services. Changes to this code for 2022 include 2.10, collaborating with colleagues, 3.07, third-party contracts for services, 3.8, responsibility to client and third-party contract for services, and 3.9, communicating with stakeholders about third-party contracted services.
Code 2.05, Rights and Prerogatives of Clients. A. The rights of the client are paramount, and behavior analysts support clients' legal rights and prerogatives, which means that behavior analysts should always support the client's rights as they are extremely important. Section B. Clients and supervisees must be provided on request an accurate and current set of the behavior analyst's credentials, meaning that behavior analysts must give their clients an accurate and up-to-date credentials upon request. Section C. Permission for electronic recording of interviews and service delivery sessions is secured from clients and relevant staff in all relevant settings. Consent for different uses must be obtained specifically and separately, and this means that in all relevant circumstances, permission is required from clients and necessary personnel for electronic recordings of interviews and service delivery sessions. Various uses require different consents, which must be obtained separately. Section D. Clients and supervisees must be informed of their rights about procedures to lodge complaints about professional practices of behavior analysts with the employer, appropriate authorities, and the BACB. This means that the clients and supervisees must be made aware of their rights and the processes for filing complaints with the employer, appropriate authorities, and the BACB about behavior analysts' professional practices. E. Behavior analysts comply with any requirements for criminal background check, which means that a behavior analyst need to comply and abide and provide criminal background checks. The modification in Code 2.05 due to the Ethics Code of 2022, this code is going to be divided and listed under 5 different new codes, which are 1.15 responding to requests, 2.03 protecting confidential information, 2.08 communicating about services, 3.01 responsibility to clients, and 3.04 service agreement.
2.06 Maintaining confidentiality. Behavior analysts have a responsibility towards their clients to maintain confidential all of the sensitive information that is shared with them, and they must protect who they work with or who they consult, recognizing that these confidentiality parameters can be set by law, the organization they work in, among others. Behavior analysts discuss confidentiality prior to intervention and if any changes occur in these interventions. In order to minimize intrusions, behavior analysts only include in their written, verbal, or recorded sessions information that pertains to the importance of the case. If need be, behavioral analysts are authorized to discuss confidential information with other professionals only if they are clearly concerned with the case, and they should only share critical information. They also have the responsibility to protect their clients' confidentiality in settings where their clients might be exposed in social media, like sharing identifying information such as photos, videos, etc. In the Ethics Code of 2022, there will be a modification in Section 2.06 that will include 2.03 Protecting confidential information, 2.04 Disclosing confidential information, 2.11 Obtaining informed consent, and 5.11 Using digital content in public statements.
2.07 is maintain records. Maintain record is maintain the appropriate and the right for create, access or transfer or dispose the records. So there are some agreements and admission based on the law, and that the ABA professionals have to has the client's permissions, or maybe the client's caregiver's permissions to record anything, to write anything. So they have to, based on the permission, the ABA professionals can do. But there are some specific situations with some specific requirements based on the guidelines. So they can do without the permission, but in every situation they have to record anything with the client's permission. So these codes will change to 2.05 documentation, protection and retention. 2.08 is disclosure. Disclosure means the secret, and this code is about the permission and the consent. So the ABA professionals have to have clients or clients caregivers permission to share any information that they want, so the confidential information. So but there are some specific situations that law gives the ABA professionals. The first one is the clients need service. Second one is to get appropriate professional consultation. Then third is to protect clients from harm, and for the last one is for the obtain the payment of special service. In these situations, ABA professionals can share just some specific information about the clients. So this will change to 2.04, disclosing confidential information in the future.
The next subsection within code number 2 is called treatment and intervention efficacy. As its name suggests, it emphasizes on a treatment provision and outcome it produces, which demonstrates its effectiveness. First, the behavior analyst has the responsibility to teach clearly and concretely the procedures that will be used with the corresponding scientific support. Treatment should guarantee immediate and lasting improvements to the client and society. Second, the behavior analyst should be thoughtful about the amount of therapy required and its division among sessions to obtain the targeted goal. Third, when a behavior analyst is faced with a situation where multiple treatments are supported by scientific research, further analysis should be done, regarding several considerations to select the best one for the client, the specific client. Some examples of considerations can be effectiveness, cost efficiency, side effects, client preferences, among others. Lastly, the behavior analyst should carefully examine the effects some interventions may have and their possible impact on the targeted goal or program for modifying behavior. This subsection of treatment and intervention efficacy will be modified in the Ethics Code of 2022. It will be dissolved in the following subcodes: 2.01, providing effective treatment; 2.14, selecting, designing, and implementing behavior change interventions; 2.18, continual evaluation of behavior change intervention; and 3.12, advocating for appropriate services.
BACB Guideline Code 2.10, Documenting Professional Work and Research. Subsection A. Behavior analysts appropriately document their professional work in order to facilitate provision of services later by them or by other professionals to ensure accountability and to meet other requirements of organizations or the law. This means that a behavior analyst must be accurately documenting their work. This could be research, intervention plans, or other, in order for themselves or another professional to use for future implementation. Subsection B. Behavior analysts have a responsibility to create and maintain documentation in the kind of detail and quality that would be consistent with the best practices and the law. Similarly to subsection A, a behavior analyst must create and maintain the best quality of documentation to ensure a client is receiving the proper treatment. In the new 2022 modifications of the BACB Guidelines, Code 2.10, Documenting Professional Work and Research, has now been split up into Codes 2.5, Document, Protection, and Retention, and 3.11, Documenting Professional Activity.
Guideline implication and use. The implication of this guideline is working in the best interest of the person receiving the treatment with proper consent from the ultimate beneficiary and the other parties involved. This code can be used as a guide in situations when we are debatable about how to proceed under circumstances regarding overall responsibility, maintenance of records, accepting clients, consultation, third-party involvement in services, rights of clients, confidentiality, records/disclosure, documentation, and overall treatment. In this scenario, we see Anna, who is a BCBA working as part of an agency. She is assigned to work with a client who is a 3-year-old boy named Daniel, who has been diagnosed with autism spectrum disorder, displaying troubled behaviors and hitting his head on the wall and excessive screaming. The parents have requested ABA services from the agency. The question in this scenario is, who would be the client? So, as a behavior analyst, your responsibility is to all the parties included. However, a hierarchy of responsibilities must be established. The person receiving the services comes first, then comes the parent or guardian that is paying for and has requested the service. Lastly, the agency. As behavior analysts, our primary responsibility is to the individual or ultimate beneficiary of the services. The highlight of the responsibility for the behavior analyst is to guarantee effective services, even when this includes the expertise of other professionals with the client's consent and in their best interest.